Thank you so much. Thank you, guys. I just want to introduce our dear colleague, Dr. Laura Manon. She will do the speech with me. So basically, she's an airway specialist, and she will talk about how the mouth, the breathing, is connecting everything to the rest of the body. And just after that, I will do a talk on root canal treatment and the toxicity of it. Okay? It's a short talk, so if you have any questions, please feel free to ask us any questions. If you want us to specifically target a special field in the biological dentistry, please let us know. Okay? This talk is for you, so make the most of it.
Thank you so much, everyone, for being here Sunday afternoon. I know it's, prime time for meal prepping, getting ready for the week, but I promise you, your future self will be really happy that you are here today. So, yeah, as Dr. David mentioned, I'm an airway dentist, and I focus my practice mostly in helping people breathe better and live better. So today, of course, I'm going to talk about mouth breathing. Mouth breathing is a very dear topic to my heart because, as you will see, it affects enormously our quality of life and our lifespan and longevity, of course. It affects over 50% of the population, and this means also kids and adults. Both are affected. And it means that we're using our mouth to breathe, basically. It doesn't count when we're sick in a particular period, but more when it's something that happens daily and most of the day. It means that we have maybe a nasal obstruction, maybe we had an accident, broke our nose is not, we're not able to breathe through it. Maybe you have big tonsils or adenoids. Maybe we live in a place where the air is not so great. Maybe our house has mold. So there's many reasons why. One of the most important ones I see in my practice is the tongue position, the tongue posture. It can be due to a tongue tie, maybe. The tongue is not able to move into the right way, which should be in the roof of the mouth. Or maybe it's because the tongue has a very low tone. Nowadays, we use pacifiers for many years, bottles, sippy cups. All of these contributes to a really low tone in the tongue that can lead to a low tongue position. But why is nasal breathing so important? At the end of the day, we're getting air through the mouth or through the nose, right? Our nose is a built-in filter for our bodies. It's a really intricate design. And it's made to give us the best air possible. It filters, it filters all the nasty, bacteria, viruses, all the pollutants from the air. It also slows down the airflow. This is quite important because if the airflow is too fast, we're not going to be able to get enough oxygen from our air. And also it will allow if it's too fast, it will also cause irritation in our airways. It also allows the correct position of the tongue, which is in the roof of the mouth. And when the tongue is in the right position, it activates the parasympathetic nervous system. You've probably heard about the vagus nerve, and I'm sure we will be hearing about the vagus nerve later on with the human garage. And the vagus nerve is the largest parasympathetic nervous system in the body. Is basically our rest and digest nervous system. And it happens to run through the back of our palate, back of the tongue, and all over down and up to the gut. So when the tongue is in the right place, every time we rest, every time we swallow, we're activating this parasympathetic nervous system, we're priming digestion, and we are helping us basically stay calm. It also produces nitric oxide. We see the sinuses on the sides of our nose. Nitric oxide is produced in there, which is a very powerful compound. It kills harmful bacteria and viruses in the airways, and it is a bronchodilator and vasodilator, which means that will help us get more oxygen from the air that we're breathing. So As you can see, it's a very effective and efficient way of breathing. It also permits us to do belly breathing, so diaphragmatic breathing, which is allowing us to use the full capacity of our lungs. On the other hand, mouth breathing uses a different set of muscles when we breathe. We are doing upper chest breathing when we're breathing through our mouth, and we're only using the upper 2/3 of our lungs this way. We also get a larger volume of air, which sounds great, right? More air, more oxygen. No, it's actually too fast, so we're not getting enough air and oxygen from the air. And also, it's really irritant to the airway. It's a lot of air, it's dry, it's unfiltered, full of bacteria, dust, you name it. So we see a lot of issues with asthma-like symptoms, with frequent upper airway infections, a lot of coughing, dry cough at night. So overall, it's a really non-efficient way of breathing. We don't get enough oxygen from the air we breathe. So what is our brain doing? Okay, we're not getting enough oxygen, so we need to breathe more. So we breathe faster. We're basically hyperventilating, okay? So when we hyperventilate, we're telling our brain that we are in danger. We're activating our parasympathetic, because this is the way we breathe when we're scared, when we're fighting, when we're running away from something, right? And it also makes us lose more minerals, because when we hyperventilate, we're basically exhaling a lot of CO2, more than what we are producing. So this will cause our blood to go a little bit alkaline, the pH will go higher, and our body does not like these changes in pH. I know alkaline sounds really good, but our body does not like huge changes in the pH. So it will cue our kidneys to produce bicarbonates, to remove all of these, to bring the pH back to normal. To produce these bicarbonates, we use minerals such as calcium, magnesium, phosphate. Sounds like pretty important minerals, right? Especially for, bone health and also for our teeth. So we see very often that patients that mouth breathe have a lot of cavities. And this is not only because of the lack of minerals or the more loss of minerals, but also because of the dehydration. When we're breathing through our mouth, we lose a lot of water in the exhalation, and we dry our saliva. Our saliva is crucial for our health, the health of our microbiome and our teeth. It's a really powerful protection for our teeth, and it keeps our microbiome healthy and balanced. So when we lose this saliva, we start to see microbiome imbalances. Certain bacteria starts to overgrow and produce disease, such as cavities or bad breath, gum disease. And then, of course, when we're breathing through our mouth, our tongue needs to be down, like this. So it will promote the growth in a vertical direction. We will see flat faces, long faces, dark circles under the eyes, and this will promote even more mouth breathing. And of course, the muscles will be even less in tone. So we need to always focus on rehabilitation of these muscles. But the problem is not just the mouth breathing. The problem is that this is a spectrum, and this is dynamic. It doesn't stay like that. It's not that we are mouth breathing as children and then we will be mouth breathing as adults. No, it gets worse over time. So if we have a child that mouth breathes now and we don't do anything, we will probably have an adult that will be snoring or maybe having sleep apnea. I, in fact, many times in my clinic treat 3 generations in the same family because I see the progression of the disease. And what we want is to avoid that someone reaches sleep apnea, because sleep apnea is a pretty dangerous place to be. Sleep apnea means that we are stopping breathing for more than 10 seconds, at least 5 times per hour. This is a very mild sleep apnea. I've seen patients that stop breathing 120 times per hour when they're sleeping. So this is quite a stressful thing for our brains. It's like we think that we're dying 120 times per hour, right? So it activates the sympathetic nervous system, which is the stress, fight or flight. Cortisol goes up, tension goes up. We start to release inflammation mediators. We see a raise in the C-reactive protein, which is a marker for inflammation, but also for cardiovascular disease. We start to see more blood clots. And overall, we see a huge risk, a huge cardiovascular risk. But probably one of the main issues I see with sleep apnea is that it destroys our sleep. It wakes us up from sleep every time. So our body is not able to go into the deep phases of sleep, because in these deep phases of sleep is when all our muscles will fully relax. So more collapsibility, our airway will fully block. So our brain is like, no, we cannot go there because we will die. So basically, when we are going into the deep phase of sleep, we come out. When we're going again into the deep phase of sleep, we come out. So we have these micro arousals. So we're not able to go into the super important deep phases of sleep where we heal, where we reset. And as we can see in this graphic, when we're sleeping, so during the day, our brain is not really very efficient in draining the toxins because the cells are really close together. There's not much space for the CSF fluid. But when we sleep, the cells kind of shrink and leave more space, so our CSF can drain easily. But this needs to be done in the deep phases of sleep. So if we never go there, we're not going to drain all this waste and toxins from our brain. We will also not be able to release the growth hormone, which is very important, of course, for kids to grow. I actually see many kids that are very small for their age. But it's also important for adults because we need growth hormone to repair tissues. We are constantly needing to renew our cells, right? And then, of course, if we're not breathing well, we're not going to be able to perform well. We see here very typical face of a mouth breather. I put a child, but we also see this in adults very often. And we see dark under the eyes, open mouth. We see low tone in the mouth. And the main red flags I see in my patients, as I mentioned before, is cavities, a lot of cavities. My patients tell me every time I go to the dentist I have a new cavity. I don't know what to do. I don't eat many sweets. I brush my teeth. But our microbiome is just not balanced. Our saliva is not there to protect us. Then we, of course, see bedwetting in kids and adults that need to get up in the middle of the night to use the toilet. This is not normal. We should not be producing urine at night. If you need to get up and go to the toilet, it's because you're not going into the deep phases of sleep. In the deep phases of sleep, there's no urine production. Sometimes, if your tension goes high because you're not breathing well, your brain will cue your body to produce urine to release all this tension, right? Then we see, of course, picky eating, mood swings, behavior that it's not so great, especially in kids, big tantrums, and in adults, we're cranky, we don't feel like, we don't have patience. All of these things are very important. And then, of course, we also have a lot of neck pain, a lot of TMJ pain, and grinding. And one of the reasons is because of tongue ties. This is one of my patients. I did the release a couple of weeks ago, and this is how much she could open her mouth before the release, and this is how much she could open it right after the release. And of course, the main complaint that she had was that she has a lot of neck pain. She was going to the physio and the osteopath every month for years. So after this, of course, we're going to be doing body work and rehabilitation, but this is going to release a lot of the fascial tensions that can travel all the way down. So as you can see, the tongue tie can be one of the reasons why someone has a lot of problems, but it's the same, for example, for root canals. Root canals can also affect the rest of our bodies, right, Dr. David?
Thank you very much, Dr. Laura. We are very lucky to have the presentation from the airway specialist. Oopsie. Let me now introduce... Can you hear me? Can you hear me now? Okay, so the documentary that you will see now is just a short version. Was released in Netflix platform in January 2019. It got immediate attention for many, many magazines and people. And it was banned 1 month later by the Association of Endodontists, American Association of Endodontists. Okay? Sorry for that. The American Association of Endodontists are the specialists for root canal treatment. The idea is for me to show you this movie, and then we discuss what is being said on this movie. Okay? If we can manage to to show you that. Is it working?
Is left in. If you think that you can get away with an infected toxic tooth and not have a systemic consequence, I think you're deluding yourself.
This is the day my whole life went to shit.
The vast majority of chronic degenerative diseases begin with problems in the mouth.
Unfortunately, the dental schools look at the mouth as being a mannequin and that you can do any type of procedure without any direct impact on the rest of the body, but this is the farthest thing from the truth.
I'm really not exaggerating. Panic attacks gave way to chronic fatigue. I was a wreck. A total lost cause. I went searching for answers.
What if I could tell you that 98% of women that have breast cancer have a root canal tooth on the same side as their breast cancer?
Of the people that come to see me with chronic illness, the question is how many of them have a dental cause of their illness? I would say almost all of them.
Currently, we have roughly 25 million new root canal procedures being done a year in the United States. One of the greatest public health interventions we could possibly do is to make the root canal procedure something of the past, because it does nothing positive for the general health of the body at all.
I'm just one guy, and this is my truth. That truth has set me free. So I didn't want my truth to just be a minority of one.
Yes, so this movie was put in January 2019. 1 year later, I got a patient. I will show you the picture later. He was 17 at that time, a local boy, 17, from Ras El Khaimah. And suddenly, he woke up one day, and he couldn't talk, and he couldn't walk. Suddenly. So, of course, the parents were completely frightened, and they rushed to the hospital. So they went to the hospital, and they did a battery of exam, MRI, brain scan, you name it. And they couldn't find anything. They went to another hospital, and again, and again, and again. And it took 2 weeks. And after 2 weeks, the mom remembered that this little boy, Sultan, had a root canal treatment a few months back. They came to us, we did a CT scan, I will show you. And basically, I will come back to that after. Yeah. Basically, we found on the CT scan a big infection. And basically, the bacteria spread to the brain. That's why that happened. We removed the tooth, immediately felt better. It took a few days for him to talk again, and a few weeks for him to walk again. And now he's a bubbly young guy, full of life. I'll come back to that later. So basically what is discussed in this documentary is what we call the focal infection. Do we produce a bacteriema, meaning do we think that bacteria that you have in a root canal treatment, infected tooth, can travel to the brain blood and go somewhere else? That's the questions, basically. We know that when a cardiologist wants to do an intervention, he sends the patients to the dentist first to avoid any dental infection because of the risk of endocarditis. We know that. But if it's true for the heart, do you think it's not true for the lung, for the rest of your organs? Do you think it's possible that it goes only for the heart? I don't think so. Now, this guy named Weston Price, 100 years ago, he did an interesting studies. He was an endodontist. And what happened is that he found out that after a few years of doing this root canal treatment for his patients, this patient became sick at some point. So he was wondering why this patient was full of life before, and then now it's on this chair and has developed a chronic disease, arthritis disease. And then what he did is he removed this tooth, and the patient felt better immediately after. Then he took the same tooth and put it under the skin of a rabbit. And the rabbit developed the exact same chronic disease. Arthritis, arthritis. Cardiovascular disease, cardiovascular disease. All the time. By the way, Weston Price, who was, before this experiment, one of the most famous dentists at that time. He was the head of the researcher of the American Academy. Then after that, he became a monster. So, interesting, this study. We need also to read the scientific literature very precisely. What says this study, for example, is that if you have arthritis, rheumatoid arthritis, it's likely that you develop dental infection. Which way is it going? That's my question. Don't you think that it's because you have a dental infection that you develop arthritis, or the other way around? I'm just here to ask questions so that everyone connect the dots. Just to tell you about me a little bit, I've done lots of research in the past. What is important here, if you have one thing to remember, is this website, EIOMT. It's an International Association of Medicine and Toxicology. So it references all the biological dentists all over the world. So if you go to Singapore, Dallas, or whoever in the world, you can look into this website and they will reference the biological dentists of your town. Interesting view. This is a natural tooth here and an infected root canal treatment, basically a dead organ. When you have a dead organ, we remove the nerve and we remove the blood flow inside. There is no blood flow inside this tooth anymore. But if you look at it from a mouse perspective, this is a root, and you see it appears like a normal tooth. But in reality, deep down, this is what you have. And when you remove that, the smell is incredible. Connect the dot. So Sultan, that we talk about, what we do in this case, we just remove the tooth, place a ceramic implant, not titanium. We don't want any metal, any corrosion in your mouth. Yesterday, it was funny. I was in the clinic, and I had a patient. No, actually, it was this morning. Sorry, it was this morning. Emergency. Patient had an implant done in France in January, and she was petrified because she thought she had lost it. Anyway, next to the implant, she had a filling, a metal filling. And I said, oh, you have a mercury filling. Because I thought it was a black filling. I thought it was a mercury filling. And she said, no, 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 no. It's a gold filling. It's a gold inlay. It was dark. Why? Gold is not dark. But corroded gold becomes dark. When you put a titanium implant full of different metals next to metallic that is not the same anode and cathode, then that creates corrosion with saliva. And then this golden metal was completely full of corrosion. And then what it does is that because the body wants to reject that, the small part that was screwed inside the implant was getting expelled by the body. And when you look at Journal of Endodontics written by endodontists, they all say that when you have a tooth, a root canal tooth, you cannot remove all the bacteria. But what I want you to understand is the anatomy of a tooth. Maybe on my next slide it will be better to understand. Okay, so that's the tooth, how we represent the tooth in our mind. When a dentist draws a tooth, it's how it does. We have the tooth, the enamel, the dentin, and the nerve. But in reality, it's not like that. You need to consider that you have a 3D anatomy of the tooth. It's not only one main canal. You have millions of small canals called tubules. These tubules, if you put them one after each other for one tooth, you have 3 miles per tooth. Wait, bear with me. This diameter, okay, is between 1 to 2 micron. The diameter of a bacteria is less, is below 1 micron. If you want, because you don't have blood flow inside, so you don't have lymph to clean the waste of the bacteria. The waste of the bacteria, it's called endotoxin. Okay? So this bacteria lives there happily and reject in the body the endotoxin. We call that endotoxemia. And in the body, and that's one of the reasons why you don't feel that, you have some big cells called the macrophage, but they're 20 microns, and they're supposed to kill that. And indeed, they kill that when they're outside of the body. But inside the tooth, they're too big to go inside. So they can't. And what you need to understand is once you have this endotoxin goes outside of the tooth, creating what we call endotoxemia. And when the bacteria goes outside of the body into the bloodstream, it's called bacteriemia. And you have both. Remember that. This article shows that an endotoxin is able to pass the blood-brain barrier. And that's very important. Why? Because this endotoxin will affect your macroglia. The macroglia is the cells inside your brain that regulate your brain, regulate the neurons, regulate everything. And that even the smallest quantity will affect the DNA of your macroglia. You understand? So if you have a root canal treatment at 20, all your life you will have this bioaccumulation of endotoxin modifying your genomes, modifying the genomes from the brain, creating some neurodegenerescence. What is neurodegenerescence? Maybe when you're 60, 70, 80, it's called dementia, it's called Alzheimer, it's called this kind of pathology. This is a neurodegenerative disease. Please feel free to ask me any questions you want. This video that I want to show you, it's done by a cardiologist. Can we have the sound? Where is he? My friend? So hopefully you will listen to that just after. Basically what it does is that it's a cardiologist, okay? And what he says is that when you have a heart attack, you will have micro hematoma, and he feels or he thinks that because of the bacteria that we find in the heart, once we have this kind of things, it creates this microclot, basically, resulting into cardiovascular disease. So I hope we'll do that. We'll come back later on if we have the sound. It's okay, no worries. So basically, when you have an infected root canal treatment, you have a release of endotoxin and bacteria into the bloodstream. Okay, three main things, three main items: cardiovascular disease, big one; metabolic disorder, diabetes. When you have an abnormal level of bacteriemia in the gum, when you have gingivitis, that creates diabetes. Okay, and also neurodegenerative disorder, as you see. My friend, can we have the sound? Where is it? Thank you.
Is in the last couple of years there have been some incredible studies done in the literature. This one group in Finland actually studied patients that had heart attacks, and that at angiography they got the blood clot causing the heart attack suctioned out. So they aspirated these blood clots that caused the heart attack, and they analyzed these blood clots for the typical DNA that's associated with pathogens in root canals and gum disease. These clots had a huge concentration of these oral pathogens inside the clot, 16-fold more concentrated than in the blood that they came from. Now, you see in the literature, lots of people like to say, oh, well, this is a correlation, this is an association. I think anybody that can look at this evidence and say that this huge concentration of pathogens and toxins inside the blood clot that forms to cause a heart attack is a correlation no more, and not a cause and effect, is just being irrational. I mean, you don't form a blood clot and then magically after the fact pathogens or toxins from somewhere suddenly accumulate in the blood clot. They accumulate, it causes the clot to form, and it's some of the most smoking gun evidence that we've ever seen that shows that these pathogens and toxins in the root canal teeth and the gums, when you chew down, they glow into the bloodstream. They pass through the venous system and the pulmonary arteries, but the reason why they get in the coronary arteries is because the coronary artery is the first high-pressure part of the vascular system that these pathogens and toxins reach. Everywhere else it's low pressure.
Okay. Now, they tell me, yes, but that's only for root canal treatment that have failed. And my question is, okay, but how many root canal treatments fail in reality? And do we know that? When you're about to do a root canal treatment, do you know what the chance of success of a root canal treatment? Anyone want to take a guess? %? This study from the American Association of Endodontists has analyzed different studies about root canal treatment. They said in between 40 to 61. Some other studies, this one, prevalence of, yeah, 80%. In reality, now we're working on AI software to show, I mean, because we believe that the AI machine will show us exactly the reality of it, that we don't see with your eyes. Because remember that we diagnose the disease or the failure of the root canal treatment on X-ray. Before, we used to have small X-rays, we had panoramic, and now we have CT scan. But this is just an X-ray. This is not the reality. And I strongly believe that the AI machine will help diagnose much more infection on root canal treatment that we see in reality.
I thought it would be fun to talk about some cases that I personally got to witness.
Please, yes, let's do it. People love case studies.
And this is something that we get to see miracles unfolding literally every day in front of us, and hence why we are so adamant about practicing the way we do. So I had some interesting cases coming my way, and one of the case was this lady. She was about 75 years old, Asian lady, who had had a series of root canal done. Some of them repeated twice because it had failed. And it's interesting, she came up with that correlation herself, not any other doctors that she had gone. And she noticed that after a while, she started having some hearing loss. And also, suddenly, in one day, there was a ringing in the ear that happened and never stopped for 2 years.
Like a version of tinnitus.
Exactly. So there's this buzzing sound which is irritating her, and she's going from one ENT, one doctor to another, and no one can find out what's going on. And then towards the end, she got the sense that people are not trusting what she's saying, and they're not believing because every test they did, they couldn't find out what's wrong. So she was complaining of ringing in the ear constantly, wouldn't go away, driving her nuts for 2 consecutive years. So finally she gives up and she goes to, and oftentimes it's a common story when people become more or less, for the lack of words, desperate, they go to holistic doctors or
I've tried everything
medicine.
else.
I've tried everything else, nothing is working, so tell me if I have to stand on my head to make this work, I will do it.
Right.
So she goes to an alternative medicine doctor, which thankfully she did the examination. She contacted me because, again, one of the things that I take pride, I'm very much in communication with all the doctors that we work. We are a very strong team, a very close team. So she called and said, Dr. Ashton, this is puzzling me. This is what's going on with her case. Do you know anything about it? Can this be anything orally that you can help me? And I'm like, you know what? I don't know. It could be ringing in the ear. Could be, could be heavy metals. Could be root canals. So, have her over. Let me do an examination. So I did an examination, and unfortunately, I found 6 root canals.
Wow.
And one of them especially looked really bad. In just the 2-dimensional X-ray, that's when I had not even taken the CT scan or cone beam. So I look at her, and this lady looking at me desperately, can you help me? And of course, I want to say, I've known of correlation, but you can never guarantee, especially someone who's been throughout the 2 years, have been seeking help from one doctor to another, and she has invested so much. She told me, how much these root canals have costed me? I did some of them twice, and so I've already invested this much, and I'm blown away. Here I am trying to tell the patient, the only thing I can suggest is after all this investment, let's remove them. So I told her what the correlation is, but at the same time told her, listen, it's not guaranteed.
No promises.
There's no promises. I have seen this happening in the past. I've seen, I've read enough data or research that there has been a correlation. In your case, I can guarantee it. And then the minute I haven't even finished my sentence, she goes, remove the tooth. And I'm like, are you sure you want to do it? He goes, yes. No, at least you trust me. At least you know that I'm not making this up. So I'm okay. Remove this tooth. This is driving me crazy.
Right, and she's probably in that situation weighing the pros and cons. Removing the tooth, there's some personal feelings around, I don't want to have a tooth removed and have it in, but what's the worst thing that can happen, and especially after all this suffering that she's
Exactly.
gone through.
So I tell her, listen, this is a big decision, especially since you have 6 teeth. Therefore, why don't you go sleep on it? Think about it, come back tomorrow. If you are agreeing to removing the tooth, I like to remove the tooth that really looks the worst to me. The root canal that actually looks the worst to me. And she agreed. She comes back the next day, I remove the tooth. She goes home. So I call to follow up and see how she's doing the following day. And then when I pick up the phone, I say, this Dr. Ashton, how you doing? She starts crying. And here I am, I'm like, oh my gosh. She's sorry she did it.
Oh my gosh.
She's already sorry she did it. It's already one day. She's crying over the phone. I'm like, what's going on? She's like, you won't believe this. I'm like, what? She's like, I've been wanting to call you, but I wanted to give it more time. I'm like, what? She goes, literally, as I was driving home, after 30 minutes of the extraction, the buzzing stopped. There is no ringing in my ear. This is after 2 years, and it's been a day now. It hasn't come back. Do you understand what this means to me? And I'm like, wow, this is really fascinating. I didn't expect the result this fast, quite honestly.
Right.
But it happened in her case. She's been a patient of my practice for.
Yeah, you see this kind of story, yes?
Is that the only solution then? Is to
No, we have another solution. But what I mean is that that's happened again and again and again. What is important is us as dentists to be trained to listen to our patients and to listen to symptoms that we are not being taught. I have some pain in my ear. I hear some noise. I have brain fog. I have back pain. We are not used to relate these symptoms with dental pain. For us, we say, you're crazy. That's how we say it. Because it's not how we've been educated. And we're all different. Maybe you will develop migraine. Maybe you will develop back pain. Maybe you will have knee pain. Now, in Europe, especially in Switzerland, because you have many, many biological dentists, they use a special anesthesia called the procaine. It's a derivative of cocaine, so that's why it's not allowed here. But if you have a dental infection that is linked to pain in your knee, for example, they numb this tooth with procaine, and for 2 hours, you won't have any pain on your knee. It's easy. It's called meridians, energy channel. But acupuncture uses this kind of channel as well. So it's not new. In Chinese medicine, this is 3,000 years old. You know, it's not new. For Western medicine, they are very, very good, and I still use Western medicine, but for acute infection. For chronic infection, I go to Chinese medicine. I just want you to think, you know yourself the best. You're your best doctor for yourself. Try to listen to what you say, to what you feel as well. It's very important. When we do a consultation, we need to listen more and more of what you say. I mean, what you think, what you feel. That's how we should diagnose things. Ta-da! We're very proud because we have assembled a team of researchers and dentists that can perform the regenerative endodontics protocol. We're probably one of the only teams in the world to do that. When I go and lecture in Europe, they don't even know these kind of things. What is it? We revitalize the tooth. It's a well-known technique for primary teeth, for baby teeth, or immature teeth, not primary teeth, immature teeth. So when the tooth is not formed completely, you have an open apex, then it's a very standard procedure. The difficulties was to introduce this kind of protocol into mature tooth because the apex is closed. What does that mean? That we take your blood, spin the blood, separate the red cells from the white cells, and inject APRL inside this tooth. That will revitalize the tooth. Of course, there is no more nerve. But the latest studies show that after 1 year, you will still have sensitivity in your tooth. Meaning, nature is so good that it will regrow a nerve inside the tooth. It's amazing. It's amazing. It's just miracles. So it's possible, but not for every children's tooth. Okay? If you have a curved tooth, it's not possible. We've done it with curved tooth, molar, and infected molar. We've done it the worst, and it worked. But in general, you need to know that it's not an old technique. We don't have a lot of literature. It's basically a Spanish technique originally. But 10 years in medicine is nothing. We don't have a lot of knowledge. And the way we disinfect the tooth, we have done it ourselves. So we have installed a protocol that allows us to do that. So we have bought a special laser called the YAG laser. It costs a fortune. But anyway, And then we disinfect with ozone as well, because ozone penetrates inside the canals. So when it's possible, that's what I would do for myself. Lots of literature now. But it's more about the protocol. You need to be very, very particular and precise in the protocol. Thank you very much. I hope you have liked it. If you have any questions, please feel free.
Thank you very, very much for that. I hope everyone enjoyed. Sorry we don't have time for questions. You can catch Dr. Roze where? Here? Are you hanging around? And at the booth as well. I will have to ask everybody to